Lidocaine cream topical local anesthetics are used on the skin to relieve itching and pain from certain skin conditions, like scrapes, minor burns, eczema, and insect bites. It can also treat discomfort and itching caused by hemorrhoids and other genital or anal area problems, such as anal fissures and itching around the vagina or rectum. Additionally, some forms of this medication can help decrease discomfort or pain during certain medical procedures or exams, like sigmoidoscopy or cystoscopy. Lidocaine works as a local anesthetic by causing temporary numbness or loss of feeling in the skin and mucous membranes. It's important to follow the recommended dosage and timing for using lidocaine cream. Be sure to consult with your healthcare provider to determine the best course of action for your specific condition. Always follow the instructions on the label and use as directed. When using the over-the-counter product, make sure to carefully read and follow all the directions on the package. If you have any questions, it's best to consult your pharmacist. If your doctor has prescribed this medication, be sure to use it exactly as directed. Before applying the cream to your skin, make sure the affected area is clean and dry as instructed. Apply a thin layer of the medication to the affected area of the skin, typically 2 to 3 times a day or as directed by your doctor. If you are using the spray, be sure to shake the canister well before using. Hold the canister 3 to 5 inches from the affected area and spray until wet. If the affected area is on the face, spray the medication onto your hand and then apply to the face. Avoid spraying near your eyes, nose, or mouth. For the foam form, shake the canister well before using. Spray the foam onto your hand and apply it to the affected area. It's important not to use the medication on large areas of the body. Cover the area with waterproof bandages or plastic, or apply heat unless your doctor has specifically instructed you to do so. These actions may increase the risk of serious side effects. After using the medication, be sure to wash your hands immediately, unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or ears. If it does come into contact with these areas, rinse them immediately with clean water. The dosage of this medication is based on your medical condition and how you respond to treatment. It's crucial not to use more of the product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, make sure to consult your doctor before using this medication. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help right away. When using lidocaine cream, you may experience temporary redness, stinging, or a little swelling at the application site. If these effects persist or worsen, it's important to let your doctor know. If your doctor has prescribed this medication for you, it means they have determined that the benefits outweigh the risk of potential side effects. Most people using this medication do not experience serious side effects. However, seek medical help immediately if you experience very serious side effects such as slow or shallow breathing, seizures, pale or bluish skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat. Although very rare, a serious allergic reaction to this drug may occur. Seek medical help right away if you notice symptoms such as new or worsening rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the US, if you experience any side effects, consult your doctor for medical advice. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before using lidocaine cream, make sure to inform your doctor or pharmacist if you have any allergies to lidocaine or other similar anesthetics. Also, let them know about your medical history, especially if you have broken skin, heart disease, liver disease, or a certain blood disorder. If you are going to have an MRI test, it's important to inform the testing personnel that you are using this product, as some brands of lidocaine cream may contain metals that can cause serious burns during an MRI. Before undergoing any surgery, it's crucial to inform your doctor or dentist about all the medications and products you are using. It's also important to note that children may be more sensitive to the side effects of this medication. If you are pregnant, use lidocaine cream only when clearly needed and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. When using lidocaine cream, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of lidocaine cream as a topical local anesthetic. Remember, always consult with your healthcare provider for personalized medical advice. If lidocaine cream is inhaled or swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can reach out to a provincial poison control center. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. Always use lidocaine cream as directed and seek medical help if you suspect an overdose. Make sure to use lidocaine cream as directed by your doctor. It is important to follow the dosage instructions carefully. Apply a thin layer of the cream to the affected area, usually up to 3 to 4 times a day or as directed by your doctor. Rub the cream gently into the skin. Wash your hands after applying unless the area being treated includes the hands. Do not wrap, bandage, or cover the area unless directed to do so by your doctor. If you are using the over-the-counter product to self-treat, read and follow all directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. If you use lidocaine cream on a regular schedule and happen to miss a dose, just use it as soon as you remember. But if it's almost time for your next dose, then just skip the missed dose and go back to your regular schedule. Don't use double the amount to make up for the missed dose. Just stick to your regular dosage. And remember, always follow the instructions provided by your healthcare professional. When using lidocaine cream, it is important to store it at room temperature and avoid freezing it. Keep it out of reach of children and pets. Additionally, do not store the gel, foam, or spray near high heat or open flame, as they are under pressure. It is important to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.